Okay, welcome back. If you're thinking about how nice it would be to have a facelift, maybe make you look younger and make you feel better about yourself, but you're thinking, I don't know if I'm ready for that. Well, maybe you're ready for a liquid facelift, and Dr. Suzanne Yee is here along with Anna to show us, immediate results from these, because you have just been doing this before the show. Thank you for coming, Anna. We appreciate it. Let's talk first of all, what is a liquid facelift?
Well, liquid facelift is a non-surgical option to plastic surgery. We use Botox and Dysport, which are neurotoxins that help decrease the lines and the wrinkles, and also fillers such as Juvederm or Restylane or Sculptra or Perlane, any of those fillers to refill the face. So it decreases the lines and the folds, but it also revolumizes the face and gives you a lifted look and a refreshed and rejuvenated look.
And you're not going through the surgery that a facelift requires.
No, and we do it all in the office. It takes about 45 minutes to do the whole procedure, and you leave and you can go back to your business. You may have a little bit of redness, you may have some bruising, but that all dissipates.
Okay, very good. Okay, we're going to show you the video of what Dr. Yee was doing as we all came into the studio today with Anna. And first of all, she had already had some Botox, right?
Yes,
okay.
She had Botox about a month ago, so it's already taken effect. And then we put some numbing cream on the area so that when we inject the filler, she doesn't feel the needle.
Okay.
And now here you see me placing the filler into the temple to refill the temple area, because as we become more mature, we lose some of that fullness in our temple area.
Right.
And then we'll go onto her cheek and fill the cheek and then the lower face. And we try to fill up the nasolabial fold and the marionette lines, as well as any fine lines around the mouth. And then we can also inject her lips, which we will do later. But we've only done one side of her face, and you can see it's immediate results. And she doesn't have very much. She doesn't have any bruising.
Right.
She has very low redness, although it is a little bit red.
Yeah. Now,
she has some swelling.
People who hate needles don't even like watching this, but why don't you tell us what does it feel like?
I hate needles.
You do?
I hate needles, and the good thing about having it in your face is you don't have to see it. But there was no pain.
Really?
I mean, she numbed me before, and there's no pain.
The numbing cream does the trick, and you don't feel it at all.
Exactly.
Yeah, and is that what you hear from most of your patients?
Yes.
Very little pain.
Very little pain, but the numbing cream does make a huge difference. But also, the injections have lidocaine mixed in with it, so as you're injecting, it starts numbing also. So that makes a huge difference.
Okay.
Before they didn't have that.
Now, when can patients see their best results? She said she's going to be red for a little while, and we can kind of see that.
Well, in 2 or 3 days, she'll have her best results. By tomorrow, or even by this afternoon, she can put makeup on and go about her business. She may be a little bit swollen, but a lot of people really don't notice that.
Right. Now, this is the side that was injected. Sort of tell us the difference you're already seeing in the two sides.
On this side, you can see this side of her temple is fuller.
Right.
Here, and this is hollow. She has a much fuller cheek. This area where it's a little bit depressed is fuller here.
Right.
This fold is much better already. And also here we filled in. And so we'll go back to the office and do a little bit in her lips just to give her a little bit of fullness. And in some of the lines.
But, and it will become more natural, more and more natural looking over time, right?
Yeah, well, over a period of 2 or 3 days, it's pretty much where it's going to be.
Very good.
So no downtime and great effect.
Very nice. And no real side effects other than, like you said, maybe just a little bruising or redness. Okay, and you guys have a special offer for this?
Yes, we have a 10% off of all of our injectables for this month. And also, it's our 10-year anniversary, so we've been in practice for 10 years in my present practice, so we're sort of celebrating that.
Yeah, 10 years on Highway 10?
Well, in the
total.
Yes.
Gotcha.
Yes, I've been in practice for 18 years, but this practice for 10 years, so we're really excited.
Oh, 10-year anniversary. Congratulations. So 10% off because of that. Well, thank you so much, Anna, for coming today. You look great. We can already tell the difference, and thank you, Dr. Yee. Be sure and give them a call at Cosmetic and Laser Surgery Center, 10-year anniversary, and there's the phone number for more information. You could just go in for a consultation, too, if that's what you would like to do. Then I'm sure Dr. Yee and her staff will be happy to do that. Thanks so much. Okay.